Who knows more about bringing people and communities together to live their best lives than the American Diabetes Association? The ADA's mission is to prevent and cure diabetes and to improve the lives of all people affected by diabetes. It's the nation's leading voluntary health organization fighting to bend the curve on the diabetes epidemic and help people living with diabetes to thrive. For nearly 80 years, the ADA has been driving discovery and research to treat, manage, and prevent diabetes while relentlessly working on a cure. The ADA helps people with diabetes thrive by fighting for their rights and developing programs, advocacy, and education designed to improve quality of life. Susan Sarro is here with us today. She is the executive director of the American Diabetes Association in New England, which represents Rhode Island, Massachusetts, Connecticut, New Hampshire, Maine, and Vermont. She has more than 20 years of progressive leadership experience in both the nonprofit and for-profit sectors. Susan specializes in navigating change, building and rebuilding underperforming businesses and teams in order to reestablish an effective presence and growth in her respective territory. Susan, we're so happy that you're here with us today and so happy that you're partnering with Rhode Island in its efforts around diabetes. So welcome.
Randy, thank you so much. It's really been a great experience to be involved with Rhode Island Department of Health, and welcome to everyone who's participating and interested in today's World Diabetes Day event. We're really excited to bring a Touch of Sugar video to this platform. I'll tell you a little bit about the video, and then we'll come back and have a conversation with our two experts. We have Dr. Chen, who is the Director of Endocrinology from Care New England Health System, and then we have Kathy Shilko, who's a certified diabetes educator and also a dietitian from the Care New England Wellness Center. And I'll tell you more about their experience in a bit. But before we roll the video, A Touch of Sugar looks at the diabetes epidemic that affects every community in the United States, told through the voice of people living with this chronic disease, much like our last interaction with the young ladies that were speaking about their experience. Diabetes management doesn't occur in isolation. These stories in the video bring the emotional challenges, the social challenges, public perceptions that have a significant impact but go unnoticed far too often. So it's been created in collaboration with Merck, and it was directed by a woman by the name of Amy Simon Kennedy. A Touch of Sugar attests to the resiliency of the human spirit and challenges the national perception of life and living with type 2. The film shows how the disease affects people across the United States and reinforces type 2 diabetes as an urgent public health issue through interviews with patients and their loved ones, as well as doctors. So why don't we roll the video, and we'll come back and we'll have a Q&A with Dr. Chen and Kathy Shilko, and we'll answer questions from folks that are listening in. Thank you, Randy, and welcome, Grace Diaz. I want to introduce our panelists so we can really dive into answering questions. If you do have a question, please, we encourage you to put it in the chat box. Let me introduce our two panelists. First, I want to introduce Dr. Kenneth Chen. He's the Director of Endocrinology, Diabetes, and Metabolism of Care New England Health System. He's also the Director of the Division of Obstetric and Consultative Medicine and the co-director of the Integrated Program for High-Risk Pregnancy at Women and Infants Hospital. Dr. Chen is currently an assistant professor of medicine and assistant professor of obstetrics and gynecology at the Warren Alpert Medical School of Brown University. He's completed a dual fellowship in endocrinology at the Prince of Wales Hospital, University of South Wales, Sydney, Australia, and in obstetrics and consultative medicine at Women and Infants Hospital in Brown University here in the US, of course. Welcome, Dr. Chen.
Thank you.
Our second panelist and expert is Kathy Shilko. She's a registered dietitian, certified diabetes educator, certified diabetes outpatient educator, as well as a cardiovascular disease outpatient educator. And Kathy, I'm sure I am missing many accreditations next to your name, but you've been a registered dietitian since 1990 and received your BS degree in food science and nutrition from the University of Rhode Island. You've been working at the Care New England Wellness Center for the past 15 years, and the Care New England Wellness Center is accredited by the American Diabetes Association and certified by the Department of Health here in Rhode Island as outpatient diabetes education wellness center. So welcome to both of you.
Thank you, Susan.
Thank you.
I don't know about you, but like Randy, I cry after watching that every time. And there's just so many poignant messages and moments in that video. And I know we're going to kind of talk about that in a moment, but one of the things I think would be helpful for the group is to learn about each of your roles as it relates to, the treatment of diabetes. So Dr. Chen, could I ask you, talk about why an endocrinologist is important in someone's overall care? And I think for some people, what does an endocrinologist do?
Sure. Thank you for that question. And again, thank you for giving me this opportunity to participate today. It's my pleasure and honor to do so. So I see diabetes as very much a team, a disease that needs to be managed by a team of professionals. Mostly it's being managed by primary care doctors in the community. And usually, typically what happens is that they would refer the more complex and difficult to manage cases to me. And by that, I'm referring specifically to people who've had diabetes for a while. And unfortunately, if they're not doing quite so well, they may refer them on to me, because these days there are a lot of newer medications out there that some of the primary care doctors may not be so familiar with. There's always a lot of new medication technologies that are coming out. And so I would typically, me and my colleagues would typically get involved with those. And then, of course, there are a lot of other team players, especially like Kathy, who you hear from in a minute. She's a registered dietitian as well as certified diabetes educator. For me, they're key part to the management of this condition. And then there's also a lot of other people who are involved, including podiatrists, eye doctors, and so forth, just to name a couple.
And can I ask, before I go to Kathy, the study of endocrinology is what? What is that?
So the study of endocrinology involves, I guess diabetes would be the main condition, but there's also other conditions that we specialize in, specifically the thyroid, pituitary gland, adrenal glands, male and female reproduction. And that's actually partly how I got into doing, dabbling in high-risk pregnancies, because I became fascinated with managing pregnant women, with various conditions, especially diabetes during pregnancy. And of course, metabolism, so obesity and metabolism is a big part of our practice as well. And of course, also one last thing is lipid conditions, like people with high cholesterol and hypertension and those kind of things too, we look after.
Got it. So Kathy, how about you? Talk to us about being a registered dietitian. What does that mean? And I know you're a certified diabetes educator too. If you want to maybe talk a little bit about those two things, and then we'll dive into some questions related to the video.
Okay, sure. Well, as Dr. Chen said, thank you very much for making me a part of this special day. The video is very touching. Every time I've watched it 4 times now, and each time, you pick up a little bit something different about one of those families. But basically, a registered dietitian is just one of those key players in that team approach to managing diabetes. But a lot of times when people come to us, they might be in the pre-diabetic, or they maybe have just been diagnosed with diabetes. So a lot of times they're, feeling a lot of different things. Like in the video, they have absolutely no information at all about their diabetes. They're not even sure what that means. So a lot of times it's just really just a basic talk about what diabetes is, how it's affecting their body. And then obviously the dietitian part is just taking any of their dietary concerns and trying to help them see how that can help them to manage their diabetes better. A lot of times it's just, simple nutrition, because a lot of times, everybody talks about carbohydrates and how we have to watch the carbohydrates, but they might not even really understand what that is. So it's just some basic nutrition about food, about carbohydrates, proteins, and fats, and how it relates to their diabetes. Like the video shows, reading a food label. A simple thing is just going over how to read a food label, because a lot of people aren't familiar because it's very confusing, you know, so kind of keying in on some key things of what to look at, you know, instead of sometimes, you know, trying to look at the whole thing, maybe just focusing on certain points on the food label that's concerning to them, whether it's their high blood pressure too that they might have, or high cholesterol. And then also the other thing that we always do is definitely, like the video shows, is trying to make them feel that they're not alone in this and that it's really a family thing. How we're, you know, suggesting that they eat is not really just for them, but really how the family should eat. So really trying to incorporate just healthy eating habits. I like that scene where they're cooking that meal and just making it look delicious and healthy. So really just talking some just basic dietary and healthy eating habits, you know, is really, you know, especially that first conversation with somebody when they're coming in and they're thinking that, you know, oh my gosh, I can't eat anything. We try to just encourage them. And yet there's still things absolutely that you can eat and that everybody can eat.
That must be reassuring. So one of the things that strikes me in the video is the story about the woman who had diabetes, did not educate herself. Her son gets diabetes, and then she's ferociously, as any mother usually does to protect their child, wants to learn everything about, you know, his condition. My question is, and we've talked a little bit about this in prepping, you know, as a, you know, working in this field, I've heard many people talk about the fact that they're diagnosed, but wait years in addressing it. Dr. Chen, can I start with you? Can you talk about the importance of why one should not wait to take diabetes seriously?
Yes, absolutely. Thank you for the question. So it's important to take action as quickly as possible because if left untreated, the condition can deteriorate reasonably quickly and people can get complications, which unfortunately frequently are not reversible. The patients that I've seen who take this condition seriously right at the very beginning, including when they're just pre-diabetic, they can do very, very well for a large number of years, either just through like diet and exercise changes or on very, very low amounts of medications for many years. But you know, but it's more that, you know, if like I said, if left untreated, then people may have to potentially start going on insulin fairly quickly. And I've noticed that, like I said, some of these complications may not be reversible. So I think, you know, it is most important to once again seek advice reasonably early, and we're all there as a team to help you know, anybody through this journey. And you know, we're not there to judge, and we're there to help. And we also want to be in a position to offer the various multiple types of treatment that are now available sooner rather than later.
You know, you use the word judge, and I'm looking at the questions that we, you know, had kind of talked about prior to this viewing. And even in the video, I think across all stories, there was a moment where people were talking about feeling judged or shame or wanting to hide that they have diabetes. So, you know, Kathy, I'll start with you. You know, what do you do to make someone feel more comfortable? You know, I think sometimes I hear stories of people that don't want to go to the doctor or seek any professional help because of this embarrassment. And Kathy, we'll go to you, then Dr. Chen, I'd love for you to weigh in on that because hopefully it could help some people feel more comfortable.
I think that does happen, unfortunately, more so than we would like to really understand. Even in the little segment before, you know, for children or adolescents with type 1, I think the more people know about it, the more that they'll understand that, you know, that people don't do this to themselves. And it's really something that is definitely manageable and, you know, really needs a team approach and a partnership together. I've had a lot of times people come to me and tell me that they, you know, are going either to like a holiday party or a birthday party, And, you know, when it comes time for the cake, people will be like, oh, no, you can't have any cake, you know, because you have diabetes or something like that. So I try to always say that, you know, yes, diabetes is something where you need to watch, obviously, your sugar intake or your sweet intake, but it's okay to have that occasionally sweet, that you can work it into your meal plan, and through, you know, maybe watching the rest of the day, that you can balance it all through, or doing a little bit more exercise. So I think it just needs education for, obviously, the person living with diabetes, but also the family members and just the community, that it is something that is manageable, and you know, is something that it's okay, you know, to talk about and to know a little bit more about.
Yeah, and I think in the video, the one example where the young lady who was talking to her doctor, and she said how appreciative she was that the doctor took an interest in her as a human. You know, Dr. Chen, do you see that often? You know, like the doctor's like, oh no, it was just I'm your partner, but look at how that woman felt that the doctor truly was taking that time.
Oh, absolutely. So the key thing is that it's very important to develop a trusting relationship with the patient, that they feel like they can frankly tell you anything. And one of the things is that when they tell me something, even if it's not something that I necessarily want to hear, I make them feel comfortable that, you know, like I said, we're there to help. And everybody has very different life circumstances. There are some things that frankly people may not be able to control. Like people may be working very long hours without much time to be able to, I guess, frankly, exercise regularly and cook healthily for themselves. And, you know, my job is to, or our job is to really work with everybody in their unique life situations. And once again, my job is to actually promote some of the newer technologies that are out there. So as an example, these days, there are glucose sensors that people can use to monitor the glucose levels a lot more closely. I see all the time, like patients, they work in occupations where it's very hard for them to be doing finger prick glucose testing themselves during the day, like because of, you know, of the kind of work they do. And my job is to, you know, help people, you know, facilitate the use of these new technologies. And another example is that there may be patients who are not able to take their insulin injections on a regular basis throughout the day, again, because of various work restrictions, and if they're eligible for an insulin pump, then sometimes it might be good to introduce these ideas to them. My job is to, like I said, you know, work with people closely, encourage them to be honest with me about where things are at, and my job is really just to listen to everybody and help them figure out ways to improve themselves, because ultimately, you know, as Kathy's already said, you know, people didn't bring diabetes on themselves, like, and it's our job to really just, like I said, help and facilitate, you know, the treatment for everybody. Like,
yeah, and we're getting close to our time. I want to ask one more question, see if we can wrap up right at 12. But some folks are thanking you for explaining the healthcare team other than primary care. They're also saying that, you know, in the interaction, it looks like there could be the need for more explanation on what A1C is, what A1C means. I don't know if you want to take that real quick, Dr. Chen.
Sure. And A1C is a level that gives us an idea of what somebody's average blood glucose levels have been over the preceding 3 to 4 months. It's a rough guide, and I want to highlight that there are some conditions that can make this test a little bit inaccurate, but overall, in the big scheme of things, it gives us a general idea of where things are at, and it's a good way for us and the patients just to kind of have an idea of tracking how the diabetes has been progressing, particularly, like I said, over the preceding few months. So typically, you know, if I see patients 3 to 4 times a year and I bring them back with this blood test, me and the patient can discuss about how things have been going in the preceding few months since the last appointment. Like,
yes, and Dr. Chen, people are thanking you for addressing the fact that people come from different backgrounds and, you know, work and their lives are different. So people are really thanking you for acknowledging that. You know, the last question I want to ask is just your overall impressions of the video. We had so many other questions to go. We could literally spend hours pulling this video apart. But I think just from your perspectives, to round it out, because we have about 2 minutes, and I promised I would get us done on time, but it would be great if each of you could just share your overall impression of Touch of Sugar. And I do want everyone to know that if you're interested in, getting a copy of that, you can go to americasgreatestchallenge.com and look for more information. If you are, tuning in as another group, there are ways to see the video again. But let's ask real quick and then we'll pass it back off. So Kathy, why don't we start with you? What was your overall impression of the video?
Yeah, and real quick too, I just wanted to say that, in the video, there was a point too, when, we're meeting with people, it's important, we always have our agenda of what we want to cover in our appointments, because it's so, we have all this information we want to share, but it's always important to listen to what their agenda is. And like Dr. Chen said, everybody's schedule is different. So maybe, they just, are working third shift and they don't know how to eat in the right way. So I'll focus just on that. It's really what their agenda is, not really what I need to tell them, all this information I want to tell them.
I wish we had more time to spend on the interaction between a doctor and patient and coming prepared and things. So maybe we'll put a pin in that. And
absolutely. But I think the main thing from the video is obviously that diabetes, clients, they are not alone. There's so many people that are involved in the treatment and that participation of that partnership. But I think the one thing that, to take from that is that obviously change of any sort is not easy. It's difficult. But, taking just one step at a time, you can certainly get to where you have to be to manage your diabetes. And just knowing that you're not alone, you've got a slew of people and healthcare people and the community, family, friends that are there to support you in this partnership.
Yep. And Dr. Chen, we may have to have Kathy be the last word because I promised Randy I would be on time. So we really want to thank both of you, Dr. Chen, Kathy Shilko, for your time today. We appreciate your perspective and, giving us some time today. And thank everyone for tuning in.
Thank you all. Best wishes for the rest of the day. Thank you.
Thank you very much.